all your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
Hello dear friends, good evening. Here we meet again in yet another episode of BMC Global Live Al Hilal Health World, nothing but lifestyle. As you are aware, this is a talk show exclusively with the expert doctors of Al Hilal hospitals and medical centers. The groundwork for all happiness is good health. Today we would be discussing about the symptoms in urological diseases. And we have the specialist urologist from Al Hilal Hospital, Muharrak, Dr. Shabina Nas with us. So, doctor, welcome to the show and thank you for joining us today.
Thank you so much. I'm Dr. Shabina, working as a specialist in Al Hilal Healthcare Center. So, I'm here to discuss regarding the symptoms.
So, doctor, how do urological diseases present themselves?
In fact, there are many symptoms. The way the patient presents to us means they come to us with this certain kind of symptoms. So we come to know this is maybe the most probably the urological disease symptom. So these are the lower urinary tract symptoms. It is pain, means anywhere in the urinary tract. It can be the hematuria, blood in the urine, hemospermia, okay, it can be the nocturia, urinary incontinence, along with that the lumps in the groin, lumps in the scrotal area. So these are all the urological symptoms. So I will discuss one by one in little detail means what are these symptoms and what kind of diseases can present these symptoms. So first is the lower urinary tract symptom, which is quite common, and lower urinary tract symptom can be the obstructive symptoms and can be the irritative symptoms. Obstructive symptoms are like poor flow, hesitancy, straining, intermittency, post-micturition dribbling, and irritative symptoms can be the frequency, urgency, nocturia, and dysuria. Okay, in the broad term, the lower urinary tract symptom can be because of the pathologies of the bladder, prostate, and the urethra, and also the neurological diseases which affects the nerves innervating the bladder. And these diseases can be the infective inflammation or the neoplasm of these organs. Along with that, we have other symptoms like blood in the urine. The blood in the urine can be the visible hematuria, means the patient present with the symptom is I'm having blood in the urine. Okay, so it's visible hematuria, and sometimes we do the investigation and we come across with the blood in the urine, so we call it a non-visible hematuria. And another symptom is pain. Pain means it's a quite frequent symptom with the patient comes to us. Most of the time, this pain is quite severe, and it is associated with the obstruction like the ureteric stone and urinary retention, or can be the inflammation, pyelonephritis, cystitis, urethritis, prostatitis, like this. And the other symptoms are hemospermia, like blood in ejaculate. It can happen because of the infection, inflammation, and hyperplasia, carcinoma of the prostate. It can happen in the inflammation of the epididymis. It can happen because of the inflammation of the seminal vesicle, infective urethritis, and along with the STIs. And nocturia, what is nocturia is more than 2 times urination at night, and it has urological causes along with the non-urological causes. Urological causes includes the overactive bladder, enlarged prostate, incomplete emptying of the bladder. Along with that, non-urological causes include diabetes mellitus, diabetes insipidus, INP. Different drugs causes this symptom, and autoimmune disease. And we have urine incontinence. What is incontinence? Means involuntary loss of the urine, and it can be the continuous means it is throughout the day, and it happens because of the urinary tract fistulas. It can happen because of the ectopic ureter. And we have stress incontinence, which is common in the women of the childbearing age and the post-menopausal women and the male patient after the prostatic surgery. Urge incontinence can be because of cystitis, overactive bladder. Along with that, we have overflow incontinence. Overflow incontinence happens in the patient with the chronic urinary retention, and they have dribbling of the urine. So this is the overflow incontinence. And the enuresis, which is common in the children up to the age of 3 to 5 years, and after that we will see means what's the cause for that. And another thing is you can have the lumps in the groin, and if you have lumps in the groin, it can be the inguinal hernia, it can be the undescended testes, it can be the hydroceles of the cord, it can be the lipoma, it can be the psoas abscess, it can be the enlarged lymph nodes, and you can present with the lumps in the scrotum, which can happen because of the testicular tumor. It can be the hydrocele, it can be the varicocele, means inguinal hernia, also present by the lumps in the scrotum. You can have the species cyst, you can have the myobacterial epidermoarchitis. So means these symptoms, when we see any of these symptoms, what we do, we investigate the patient accordingly and then make the diagnosis and then treat the patient what is the cause of the symptom is.
All your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
So doctor, now you mentioned about the pain. Can you explain about the pain in detail?
As I said before, the pain is the quite common and frequent complaint the patient comes to us, and different organs in the urinary tract present with the different symptoms. Like if you have pain in the loin or flanks, means like in the costovertebral angle, and it's sometime radiating to the upper abdomen, to the umbilical area, and presented with the gastrointestinal symptoms. So most of the time it is the renal pain. It can be because of obstruction, it can be because of the stone, it can be because of the tumor and the cyst, anything. And uteral pain, they are acute pain. They are most of the time because of the obstruction. They are associated with most of the time with the lower urinary tract symptoms, depending upon the site of the obstruction, and along with that also the patient present with the nausea and vomiting. And this pain radiates to the lower abdomen or to the ipsilateral testes or the labium as well. And vesical and prostatic pain present with the sometimes the dull pain or dull ache in the suprapubic area. It can be because of the inflammation, means like cystitis or the prostatitis or any other issue with the bladder or prostate. And they can also radiate to the urethra. And penile pain can be because of the referral pain from the bladder or prostate, or it can be because of the urethritis, it can be because of the Peyronie's disease, it can be because of the priapism, it can be because of the trauma or something. And along with that we have the scrotal pain. Scrotal pain can be happen because of the epididymoarchitis, it can be because of the hydrocele, it can be because of the varicocele, and it can be because of the testicular torsion, which is not too common, but in the young age is very common. So the different organ present in the different ways, so we examine the patient and see what kind of the pain or what kind of the condition patient is suffering, then we treat accordingly.
Doctor, we would like to know more about the condition in which there is blood in urine.
Okay, means blood in the urine, we call it hematuria, and as I discussed before, hematuria can be two types, and it is visible hematuria, means gross and frank we also call it, and it can be non-visible hematuria. Non-visible hematuria can be the symptomatic and asymptomatic. Symptomatic means they are presenting with the lower urinary tract symptoms as well. There is a significant hematuria, means like any single episode of the visible hematuria, any single episode of symptomatic non-visible hematuria, are persistent asymptomatic non-visible hematuria, means 2 of the 3 dipsticks they are positive. So this is a condition a patient needed to be referred to urologist. And the non-significant transient hematuria can be because of the UTI, because of the exercise-induced hematuria, myoglobinuria, or menstruation. Means when you treat the patient, it goes. And there are a lot many causes for the hematuria, like infection. Infection can be the bacterial, fungal, parasitic, mycobacterial, or infective urethritis, and inflammation like the cystitis because of the cyclophosphomides or the interstitial cystitis. It can be the stone, means stone in the kidney, urinary bladder, or the urethra. They can present in a way, means you can have blood in the urine. And you can have the blood in the urine because of the tumor, TCC of the kidney, TCC of the bladder and the prostate, along with the RCC, squamous cell carcinoma of the bladder. They all present in a way, means you can have the hematuria. And because of the trauma, you can have the hematuria, and trauma can be to the urinary tract. Because of the traumatic catheterization, because of the pelvic fracture, and the renal cyst also present in a way, you can have the blood in the urine. Other urological causes include the enlarged prostate, you can have the loin pain, hematuria syndrome, and vascular malformation. These are also the other causes, means you can have the blood in the urine. But not all the causes are the urological causes. You can have blood in the urine because of the other diseases as well, like the nephrological diseases, IgA nephropathy, different kind of glomerulonephritis, Alpers syndrome, and along with that, the patient who are taking the anticoagulation therapy, who are having coagulation disorder, who are having vascular diseases, means vasculitis they are having, which causes the necrosis of the system, and they can present in the hematuria. You can also have because of the medicine, and it can be because of the renal necrosis as well.
So doctor, any advice from your side for our viewers?
Okay, for the viewers is that means this is a hot summer, and also as we are also mentioning in other episodes as well, the area is means quite hot area. You need to drink a lot of water, means a lot mean just adequate amount which is necessary for your body, means it should be more than 2.5 liter to 3 liter per day. Okay, along with that, to avoid the stones or any other things, you need to control your disease, like the diabetes. If you are having, you need to decrease the salt intake, you need to decrease the sugar intake, and whenever you are having any symptom, any of these symptoms, must visit your doctor so you can have the early diagnosis and early possible treatment.
So doctor, what do you have to say about Al Hilal Healthcare to our viewers?
Al Hilal Healthcare is the fastest growing healthcare centers in the Bahrain, and we are having a good team working together, and we have different services available for the patient in our healthcare. Like we are having a free urological camp every Friday from 8:30 to 9:30 available for the patients, and they can come and they can visit us and can have the diagnosis for their diseases.
Thank you, doctor.
Thank you so much.
Thank you for joining us today.
Thank you for
giving us a lot of
inviting
valuable
me.
information. This was indeed a very informative episode.
Okay, thank you so much.
So viewers, I hope this episode was very useful to clear all your doubts. Till we meet again with another topic in another episode, this is Jasila Mujib signing off. Good night.
All your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.